I'm Peter Costa, U.S. Medical Affairs Lead for Bavarian Nordic. My background and training is in public health education and epidemiology, and I've had the great honor of helping to educate people all around the world about rabies. I'm here to discuss how rabies post-exposure prophylaxis, or PEP, works in practice, using case studies, as well as to share important do's and don'ts and additional useful resources. We'll start now with the first of 3 case studies. During a recent hunting trip weekend, your patient, who had just arrived at his cabin, fell asleep while eating a bag of cheese puffs. He awoke to find a raccoon on his chest eating his cheese puffs. Afraid that the raccoon might bite him, the patient proceeded to stab the raccoon with his pocket knife. The raccoon hissed and then bit the hunter on his forearm and ran out of the broken screen door. The patient chased, shot, and killed the raccoon. He returned to his cabin and washed the bite wound with soap and water. 2 days later, on his way home from his hunting trip, he thought he should swing by the hospital. He brought the raccoon with him. He asks that the animal be tested, so maybe he wouldn't need to receive rabies shots. So what would you recommend? A, all hunters are vaccinated against rabies, so you ignore any concerns of rabies exposure. B, submit the raccoon for testing, even if the tissues are not suitable for diagnostic testing. C, inquire what kind of cheese puffs the hunter was eating, so that you can more effectively attract wildlife to your own neighborhood. Or D, immediately begin rabies post-exposure prophylaxis and instruct the patient to next time submit any potentially rabid animals to the local health authority. And in this case, hopefully you recognize this was in fact a high-risk exposure by a wild animal and chose option D, which was to immediately begin post-exposure prophylaxis and let the patient know not to bring wild animals to the emergency room. Now let's move to our second case study. Your patient discovered an injured bat flopping around on the floor during choir practice at church. She's an animal lover and thinking the bat was injured, attempted to pick up the bat. She was lightly bitten on the palm of her hand, and the bite marks were barely noticeable. Once back home, the patient washed the bite area with soap and water, but didn't seek any further medical attention. 2 days later, a coworker overheard her story, warned her about rabies, and told her she really needed to go to the hospital. She immediately went to the emergency department and post-exposure prophylaxis was recommended. The patient received her first dose of rabies vaccine and was told to return in 3 days. No human rabies immune globulin was administered. So what would you recommend? A, suggest that the animal be found, but not worry if the tissues are unsuitable for diagnostic testing because of the low incidence of disease in these mammals. B, when the patient returns on day 3, administer human rabies immune globulin into and around the wound on the palm of the patient's hand and delay the second dose of vaccine. C, when the patient returns on day 3, administer human rabies immune globulin into and around the wound on the palm of the patient's hand and administer the second dose of rabies vaccine. Or D, ask the patient what songs were sung to the bat prior to the incident. Here the correct response is C. This patient should have received rabies immune globulin and their first of 4 to 5 doses of rabies vaccine when she initially presented at the hospital. Since human rabies immune globulin can still be administered up to 7 days after the first dose of vaccine, she can still receive her dose of rabies immune globulin when she comes in for her second rabies vaccine. As a reminder, in previously unvaccinated persons, both rabies immune globulin and rabies vaccine are needed to elicit complete coverage after a rabies exposure. Now let's take a look at our third and final case study. Early this morning, your patient, who is a practicing veterinarian, was dog sitting her friend's rather large dog, taking it for a walk, when an unknown smaller dog aggressively ran up behind. The large dog ripped the leash out of your patient's hand and attacked the smaller dog. Your patient attempted to separate the dogs by pulling the large dog away from the smaller dog, and in the process was bitten on her kneecap by the smaller dog. She suffered 9 small puncture wounds and used her water bottle to rinse out the wounds. Your patient reported the situation to the local police, who attempted to track down the animal owner but were unsuccessful. Since this was not her neighborhood, she was unfamiliar with the area, and the biting dog, which was not wearing a collar, ran off after biting her. She presented for medical care that same evening. So what would you recommend? A, all veterinarians are vaccinated against rabies, so no further actions necessary. B, inquire what species of dog bit her to better understand if post-exposure prophylaxis is even necessary. C, suggest your patient complain to her friend about the ferocious, unleashed animals that roam her neighborhood. Or D, ask the patient if she has been previously vaccinated against rabies to determine the correct course of post-exposure prophylaxis. The appropriate action here is going to be D. Although domestic animals are less likely to be found rabid, and most veterinarians are in fact vaccinated against rabies due to their higher risk for occupational exposure, an astute healthcare provider needs to consider the full risk assessment and recognize that this dog is unknown to the patient and is unable to be found or monitored for signs of rabies, and therefore its ongoing health disposition cannot be determined. So in this case, the patient would be indicated for post-exposure prophylaxis and would receive her first of 2 doses of rabies vaccine. Since she was previously vaccinated against rabies, she would not receive human rabies immune globulin. So in summary, some do's and don'ts. We want to infiltrate all wounds with human rabies immune globulin unless the patient was previously vaccinated, inject vaccine into the deltoid, or in the case of a small child or infant, into the anterolateral aspect of the thigh. Give a tetanus booster if appropriate. Report animal bites to the local health authority. And consider suggesting alternate sites of care for the follow-up vaccine doses, so these patients are not clogging up your emergency room waiting to receive a vaccination. Some don'ts, revolving largely around proper administration of human rabies immune globulin, includes not giving rabies immune globulin to a previous recipient of post-exposure prophylaxis or pre-exposure vaccination, not injecting rabies immune globulin and vaccine in the same anatomical site, not giving more than the recommended dose of rabies immune globulin, not injecting rabies vaccine in the gluteal area, not giving rabies immune globulin in the same syringe as vaccine. This informational statement from CDC is a valuable resource you can use with your patients who may have questions about rabies prevention and rabies vaccine and treatment. This website may be used as a resource to find your local health department wherever you may be in the United States. You should be leaving this module with the ability to identify the appropriate treatment steps for a person who has been exposed to a potentially rabid animal, and understanding the key do's and don'ts as they relate to post-exposure prophylaxis. I thank you for joining us, and I hope you have found this useful and informative.